Okay, sorry, it's nighttime, and so I'm using my ring light. But yes, I agree with the statement. There's a lot of times that nurses get into ICU and they get cocky AF. And you know what I think about those nurses? I don't like them. Okay, I don't want to say I don't like them, but I dislike this trait about them. When people get to the ICU, sometimes they think like, I've made it, I'm in the ICU, like this is the top of my nursing game, and that goes right to their head. But not everyone's like that. And it's important to remember where you came from. Not all nurses start in the ICU. Most nurses start on med-surg, tele, in the ER, other places, and then they get to the ICU. So you have to remember that, like, you were a floor nurse at one point, or the majority of ICU nurses have been a floor nurse at some point in their careers. And to be honest, I've been an ICU nurse for over going on 7 years now, and I do not want to be a floor nurse. Like, if I got floated to the floor, I would feel anxious, more anxious than being in the ICU, because I'm just out of my element. So that being said, you have to have respect for nurses in every area because they're doing the job that you don't necessarily want to do. I respect nurses that are working with peds patients. I respect nurses in the ER. I respect nurses that are working psych, labor and delivery, all these other areas, because those are areas that I don't necessarily want to be in. So just because you're in the ICU and it's critical care, that's awesome, that's amazing, but we can't let it get to our heads, because there are so many other nurses that are just as good of nurses as we are and just as smart, but they're in their area, they're in their element, and we need them to do their job well so that way we can do our job well. Just never forget where you came from and just be humble and respectful.